other day, I had the chance to interview Dr. Leo Gordon and Megan Gutierrez about an aggressive form of blood cancer and a new option for treatment. Recently, the FDA approved a new type of cell therapy that gives patients battling an aggressive blood cancer a new option for treatment. So Dr. Gordon and Megan Gutierrez are here to tell us all about it. Hi, guys. Thank you so much for being here.
Thank you for having us, Ashley.
Now, today we're talking about a certain type of cancer, which is refractory diffuse large B-cell lymphoma. So, Dr. Gordon, what is this and how does it differ from other non-Hodgkin lymphomas?
Right, so diffuse large B-cell lymphoma makes up about a third, a little more than a third, of the 80,000 cases a year of non-Hodgkin's lymphoma. That 80,000 puts it like number 7 or 8 in the frequency of malignancies or in the United States. Large cell lymphoma is unique in that it's an aggressive, especially aggressive type of lymphoma, but it can be treated effectively with upfront treatment, usually with chemotherapy, and where we expect to see somewhere between 50 and 60% of patients that might actually be cured. But that leaves us with a significant number of patients who either are refractory, that's that one group, in other words, who don't respond to the initial treatment, or who have a response and may stay in remission for a short time, but then have a relapse. And that's the relapse group. That's what the RR-DLBCL stands for.
Now, I know you said it's very unique, but how common is it to get this disease? And kind of talk to me about the risk factors for developing it.
So overall, about 80,000 cases a year of non-Hodgkin's lymphoma. A third are this type. Risk factors, we know age may be one. People, the median age is about 60, but we've seen people in their 20s and people in their 80s or 90s develop it. So age is not the only factor. We do know that immune suppression might play a role. So people that have to take immune suppressive drugs for other reasons, say after organ transplant, may be at higher risk.
Yeah, and Megan, can you tell me what are some of the challenges that people living with this disease may face, and what does it mean for patients to have this new treatment option?
Well, unfortunately, as Dr. Gordon points out, diffuse large B-cell lymphoma is an aggressive or fast-growing form of the disease. And when a patient's cancer returns, they and their family often must make important decisions about their treatment very quickly. And up until recently, they've had very limited options. As a result, new treatment options mean new hope for these patients.
And Dr. Gordon, tell me a little bit more about the new treatment options that are available for people with this disease.
So this treatment, Breyanzi, is a form of chimeric antigen receptor T-cell therapy. And I'll say my role in this has been an investigator on the pivotal trial that led to the approval of Breyanzi. And neither Meg or I are being compensated for our time here. But basically, what's done is that we're trying to, as I said, weaponize the T cells against the lymphoma. So cells are taken from the patient in an outpatient procedure, kind of like a blood washing sort of procedure. And then they're sent to a central laboratory where genes are inserted into the cells. It takes about 2 to 4 weeks. The cells are returned to the medical center. Patients are then either admitted, and some actually can be treated as outpatients, and get this treatment via a blood transfusion would be done. And then we watch people over the course of the next week or so, because we might see some side effects, some adverse events. Some people may develop a fever or drop in blood pressure as a consequence of this, and then some may develop some neurologic changes which can occur, which are usually transient. And then afterwards, what we've seen is, as I said, anywhere from 50 to 60% of patients achieving a complete response, and the majority of those patients appear to stay in complete remission.
And Megan, can you tell me what resources are available for people if they're interested in learning more about these types of treatments, and where can they find them?
At the Lymphoma Research Foundation, we know that a well-educated patient can be their own best advocate. So in addition to speaking to their own physician, patients and their families can visit our website, that's lymphoma.org, to learn more about every type of lymphoma, including a dedicated diffuse large B-cell lymphoma learning center. We also have materials about all of the different treatment options currently available to patients, including CAR T-cell therapy. Experts, including members of the Foundation's prestigious scientific advisory board, like Dr. Gordon, assist us in creating the most up-to-date materials and programs for patients, And our helpline can offer one-on-one support and resources. And these materials and resources are always offered free of charge.
Amazing. And I just want to say thank you so much for you guys' work. It's really spectacular, all the strides that you guys are making, and I know I can speak for everyone out there when I just say thank you for all that you are doing. And I hope that you, as you make more discoveries, that you will visit us again on the show. Thank you so much for your time. I really appreciate it.
Thank you so much for having us. It's been our pleasure.
Thank you again.
No problem. Guys, stay right there because we have more Good Day Live when we get back.